Hello and welcome to Dr. Brainwaves. I'm Dr. Susan Raschal and this is Dr. Rena Azar. And today we're going to talk about headache, but not just the average headache that you may get when your head is pounding and you take a couple of aspirin and it goes away. We're talking about the type of headache that requires emergency evaluation urgently. And Dr. Azar is going to take it from here.
That's right. So about 5% of people that come to the emergency department with a severe headache will have some underlying problem that we need to be aware of and consider intervention for. The big things we don't want to miss are things that cause you to die or things that cause you severe long-term impairment like blindness or inability to think clearly. So the basic principle with the head is that it has a skull around it. It's tissue that is very confined. There's not a lot of room in the head. So any type of expansion, any type of growth, any type of thing that causes an increased pressure in the head will decrease blood flow, decrease oxygenation, decrease health of the tissue, and potentially cause permanent brain damage. So these types of things are things like infections, encephalitis, meningitis, brain abscesses, an internal bleed in the head, epidural, hematomas, subarachnoid hematomas. Just of note, it's very important, and we'll come back to this, that if you have a sudden onset that is very, very severe, there's about a 25% chance you've got an intracranial or in the head bleed. So those are symptoms that you'll come in for, and we'll talk about that again.
Say that again.
25% of people who have sudden onset of severe pain in the head will have an intra-head bleed. And you need to come in for that.
So it's going to be immediate, it's going to be sudden onset, and it's going to be severe. And in medical school, we're trained, it's the worst headache you've ever had in your life, Dr. Azar.
So any kind of swelling that's due to increased fluid in the brain, usually that's from increased blood pressure and increased blood flow. Also decreased blood flow. If you've got narrow blood vessels or you have a stroke where a clot gets in there, you'll get decreased blood flow. How does that cause increased pressure in the brain? Decreased blood flow causes the tissue behind where that blood is supposed to be to die. When the tissue dies in our body, it starts to swell and expand. So once again, increased pressure in the brain causing tissue death. And one other unique thing is swelling of the eye compartment. There are diseases in the eye where the normal drainage of the eyeball gets occluded or stopped up. It builds up in the eyeball, and the eyeballs are in our head, and it will cause increased pressure in the brain and potentially cause blindness or brain tissue damage, which is not a good thing. So in addition to, as Dr. Raschal referred to, coming into the emergency room for symptoms like sudden severe pain. We kind of say in medicine, the first and the worst. Somebody says that, they need to go into the emergency department. In general, a severe headache in somebody who normally does not have headaches, who is older than 50 years of age, they need to come in. In addition, if the patient has any symptoms of infection, any kind of fever, any kind of stiffness in the neck, nausea, vomiting, unusual rashes, anything that's a sign of a systemic infection that could have been carried to the head, that's a person that needs to come in with a headache to the emergency department. Increased blood pressure. We say in general, if you have a severe headache and your blood pressure on the upper number is over 150, you need to come in. If you have elevated blood pressure and you're pregnant, you need to come in. I think most pregnant women know that there's a condition called preeclampsia or eclampsia, which is a severe condition that can compromise mom and baby. It occurs in the latter part of pregnancy. The further along you get, the more likely it is. Increased blood pressure in pregnancy, you need, with a headache, you need to come in to the emergency department. And finally, in reference to the eyeball disease, the acute glaucoma, if you have eye pain, you have blurry eyes, vision, or your pupils are fixed, they don't shrink and grow, those are things that need to be brought to the emergency department. So obviously one last symptom would be altered cognition, altered thinking. So if somebody's sluggish, they're not thinking straight, they're not moving correctly, that's signs that the headache is associated with some increased pressure in the brain. Those are all things that need to come to the emergency department.
And most people refer to that as a stroke. So if you see signs of stroke, then that should be addressed immediately.
So we've overviewed all the different symptoms that, if accompanied by a severe headache, need to make you come in to get evaluated. We will have subsequent videos on the routine workup of headaches in general, not emergency related headaches like these, but other headaches.
Right. But just remember, first and worst. So I love that little expression. But if it's the first headache and it is the worst pain you've ever had in the head, come in. Be seen immediately.